Thank you. And again, thank you, Senator Ono, for bringing that up. You know that we're trying to accomplish the same thing, and I think we are making. We've had the opportunity to visit with the Secretary really on several occasions recently, and I appreciate the fact that we're moving forward under your leadership. Congratulations on your retirement and your
Thank you,
service.
sir.
We really appreciate that very, very much. I know that you've really expressed an interest in further accelerating EHRM rollout. Does the fiscal year 27 budget provide sufficient funding to further accelerate the program's rollout without sacrificing quality? We want to help you.
Yeah, it does. I want to let Richard address this because there is some needs from the Senate. We need this fully funded going forward because if not, we can't. There's no going back on the EHRM. I mean, this is just, we're beyond that point. So it's got to be done. So we are looking for fully funded. We've talked about that. Richard, you want to highlight that?
Senator, the
I want you to talk about it publicly.
That's why we're talking about it now.
Yeah, exactly.
Senator, it does. The
wanna help
$4.2 billion budget request includes our ability to implement 26 additional sites. On average, it's about $65 million per site, plus the cost of the program. So our schedule and the funding request in the president's budget allows us to do that. If the funding changes, we could do more or less, but that's the ask.
Very good. Thank you. Secretary Collins, the fiscal year 27 budget request and invest in substantially in both direct and community care spending. As you know, community care serves as a vital complement to direct care, helping ensure that veterans receive timely access to services the VA cannot provide within an appropriate time frame. Can you tell us how community care investments support regional healthcare industries, particularly in our rural states?
I think it's invaluable as far as not only just the investment in rural states and the quality of health here, but also keeping communities intact with their, I think we serve a hand in glove effect with our local doctors, small communities, and working with that. But there's actually a real dollar effect here, and Richard can give you some real dollar effects for several states here if you to see how that actually affects.
Senator, the tools that we've included in CCN Next Gen, which we've talked about, allow us to measure and require quality, allow us to pay for value, not volume, allows us to use the program integrity tools to ensure the government is paying accurately, correctly, and timely. That allows us to act like a pair, which allows more providers to partner with us. This is critically important in rural areas. On average, VA provides 5% of reimbursement for rural healthcare providers. So that's rural hospitals, doctors, nurses, home health agencies, mental health providers. These agencies often operate on margins of less than 1%, and at 5% of their revenue, VA reimbursement provides a critical role in sustaining the infrastructure. 60% of our veterans live in rural areas. This is a partnership that benefits VA and our veterans. How much is Arkansas? And sir, just by way of one example, last year in Arkansas, we invested $613 million in rural providers.
Oh, that's excellent. Very good. Thank you. Do you expect the new community care contract vehicle to better enable the department to enroll community care providers?
Yes, sir, I do.
Very good. That's it. Thank you all very much. We appreciate all your hard work.
Thank you, Chairman. It was good to be with you again a few weeks ago as well. Thank you for your help on the appropriations.
Senator Duckworth.